What's up guys, I hope you're doing okay, hope you're having a great time. Today we're going to talk about an interesting subject. Today's subject is rectal cancer. Well, rectal cancer is a major public health issue due to its high prevalence and significant impact on individual health. It can be either sporadic, which accounts for the majority of cases, or hereditary, like colon cancer, in which case close monitoring is required for affected family members. Rectal cancer often develops from precancerous lesions, most commonly in the form of adenomas that progressively evolve into cancer over time. This adenoma to cancer sequence is one of the main reasons for advocating regular screening, particularly in high-risk populations. The diagnosis of rectal cancer relies on a combination of techniques. First of all, digital rectal examination, which helps detect abnormal masses or cancerous signs. And after that, we have rectoscopy, or an endoscopy that allows us to directly visualize the rectal interior. Confirming the diagnosis often requires a histological examination to analyze cells and confirm malignancy. When it comes to treatment, is multidisciplinary, meaning surgery and radio and chemotherapy. Surgery remains the cornerstone for curative treatment, but it may be supplemented by radiotherapy or chemotherapy, depending on the case and the stage of the cancer. The therapeutic approach depends on multiple factors, including the stage of the disease, the tumor's location, and the patient's overall health status. And when it comes to prognosis, it is closely linked to early detection as any cancer. The earlier the tumor is identified, the higher the chances of curative treatment and survival. Regarding age, rectal cancer is relatively rare before the age of 45. However, this incidence rises significantly with age, making it a disease primarily observed in older individuals. In this case, the average age at diagnosis is 70 years old. Rectal cancer can be influenced by various risk factors, characterized based on the impact on the likelihood of developing the cancer. Moderate risk cancer. This primarily depends on the age, with an increased risk observed in individuals over 15 years old, just like colon cancer. High risk factors. Individuals with a personal or family history of adenomas or colorectal cancer are considered at high risk. Besides that, we had chronic inflammatory bowel disease, such as UC or Crohn's disease, also significantly increase the risk. UC poses a higher risk than Crohn's disease due to its more direct involvement in the rectal and colonic inflammation. After that, or the third category, very high risk factors. In this category, we have individuals with Lynch syndrome or familial adenomatous polyposis, or FAP, are at an exponentially high risk of developing rectal cancer, as well as colon cancer. Beside these risk factors, we have some exogenous risk factors. A diet high in processed meat and proteins alongside with obesity has been established as contributing factors. Additionally, smoking and excessive alcohol consumption further increase the risk. Well, when there is risk factors, there is protective factors. So certain factors may help reduce the risk of developing rectal cancer. A fiber-rich diet, including fruits, vegetables, and whole grains, has a protective effect, as well as regular physical activity is associated with a reduced risk. And aspirin has shown the ability to lower colorectal cancer incidence in some individuals. Finally, hormone replacement therapy, or HRT, when used for more than 10 years, may provide a protective effect in women, although its use must be weighed against other health considerations. We will talk about positive diagnosis, clinical signs, and paraclinical examinations, and finally treatment in details in other videos. Thank you so much for watching until the end, and I hope these informations were very helpful to you. If you have any questions, please leave them below and I will be more than happy to help you out. Thank you so much, and I'll see you in the next one. Don't forget to watch this video right here.